Good morning, everyone. My name is Elizabeth Orlan, and I am the Associate Director of Research at the Global Health Advocacy Incubator. Before we get started, we'd like to present the moderator of our session. The session will be moderated by Lorena Ibarra, who serves as the Senior Advocacy Advisor for the Food Policy Program. She manages the Food Policy Program in Colombia and other strategic programmatic projects. Lorena previously served as the Colombia in-country coordinator, where she was instrumental in supporting a broad coalition of partners in the development of advocacy strategies. Lorena has worked with ministries, parliamentarians, local governments, civil society organizations, and academics to design and implement advocacy strategies in support of policy change in the public health sector, including food and tobacco policy for the past 10 years. In 2012, Lorena received the Bloomberg Philanthropies Enforcement Award for her work on tobacco control with the FES Foundation. Welcome, Lorena.
Welcome, everyone, and thanks for joining this satellite session of the 2021 CUGH virtual conference called Facing COVID-19, How Big Food and Big Tobacco Undermine Public Health. This conference is organized by the Campaign for Tobacco Free Kids and the Global Health Advocacy Incubator. The Campaign for Tobacco Free Kids is a leading advocacy organization working on tobacco use reduction and its deadly consequences in the United States and around the globe. The Global Health Advocacy Incubator, GHAI, a program of the Campaign for Tobacco Free Kids, is a global public health non-governmental organization that supports civil society organizations who advocate for public health policies that reduce disease and death. Through the Bloomberg Philanthropies Food Policy Program, GHAI serves as catalyst for healthy food solutions in low and middle income countries. We'll get started with this session, and we will first hear opening remarks, and then we'll dive into the corporate behaviors of each of these industries during the pandemic. We will first listen to case studies of representatives from Ukraine, Romania, and Mexico, and how the big industry leveraged the COVID-19 emergency. Afterward, we'll transition to how big food and big soda industries did the same thing in Mexico and in the US, and how civil society organizations responded in Colombia to similar challenges. In the end, we will transition to the roundtable discussion with all the speakers. Since this is a pre-recorded session, there will be a live Q&A with the audience afterwards. Now I'll give the floor to Juan Carlos Morales. Juan Carlos is a medical doctor with a master's degree in contemporary history. His work focuses on human rights, geopolitics of hunger, right to food and food sovereignty, food and conflict, among other areas. He has worked with the Colombian Platform of Human Rights, Democracy, and Development, coordinating the campaign for the right to food, and has been a consultant for the FAO and the Ombudsman Office. He's currently the Executive Director of FIAN Colombia, part of FIAN Internacional. Juan Carlos.
Good morning, Lorena, and good morning, everyone attending and hearing this conference, as well as good morning to my colleagues and to CUGH who have invited us to this conference. My opening remarks will focus on three important elements. One, which is to try to draw your attention to some of the problems of interest that have brought us here today. Another element will be to reflect on corporate trends observed within the context of the COVID-19 pandemic. And in third place, to draw your attention with respect to some of the features of practice undertaken by the tobacco industry and the ultra-processed product industry within this context of the COVID-19 pandemic. I would like to begin with the next slide. It is important to draw your attention to two things. The main reason for the problem that has brought us here today is to remind you that the consumption of tobacco and similar products as well as the consumption of ultra-processed products and non-alcoholic beverages, is on the rise, and they are responsible for increasing the risk of NCDs. The impact from these NCDs is very big, given that every year around 41 million people die because of these causes, representing 71% of the mortality burdened around the world. Another element that I would like to draw your attention to, which will be addressed over the course of this conference, is that the actions against public health undertaken by the private sector, especially by the corporate sector in relation to food, are one of the main modifiable risk factors associated with NCDs, with respect to which the states and society at large should play an extremely proactive role to try to eliminate that modifiable risk factor. I would like to highlight as well that within the context of the COVID-19 pandemic, at least 4 very important elements took place. First of all, as we all know, persons suffering from NCDs had a greater vulnerability with respect to the morbid impact from COVID-19. While this was happening, we were able to confirm that there was a generalized lack of public policies. The generalized lack of public policies was revealed to prevent and control these NCDs. This came together with another problem, which was the lack of robust health and social protection systems based on human rights, which could tend to the emergency we were in, which, of course, maximized issues linked to NCDs. Another element that should be highlighted is the opportunism and the lack of scruples by companies and states who, capitalizing on the pandemic, tried to benefit the interests of the corporate sector, which is in fact what we will see on the next slide. With respect to corporate trends observed during the pandemic, we would like to highlight 4. These are not the only ones, but we want to highlight 4 today. Some of the corporate practices during COVID-19, there's basically a very aggressive opportunism by corporations, which has led to a number of violations of human rights and has shown a lack of consideration with respect to human dignity. We have seen massive promotion of ultra-processed products, which is also linked to a misleading pandemic narrative developed by the industry. At the same time, there are many CSR initiatives and brand washing initiatives developed capitalizing on the context of the pandemic. There's an apparent concern for public health by the corporate sector, when in reality, they were developing a number of interference actions against public policies on the matter. Likewise, there's a leveraging of a narrative according to which the problems are not the companies or their products or their activities, but rather that the corporations should be registered, or public opinion should see them as the solution. And therefore, since the companies are the solutions to the problem, we should accept that they play a leading role on various issues and at different levels. We have seen, for instance, within the UN system, the aggressive role by complicit states and the companies in the process of formulating guidelines for food and nutrition systems. And this is just to give you an example. There has also been an acceleration of corporate capture processes in the midst of the pandemic, both in multilateral and state instances, something we had already mentioned. And finally, and this is of the utmost importance and it should concern us, there is a denialist silence in terms of the responsibility that corporations have as part of the agri-food sector with respect to the ecological collapse and its connected consequences of which COVID-19 is merely one example. Finally, with respect to some key elements of the practices by these tobacco and ultra-processed product companies, which will be highlighted by my colleagues later, we can mention 5 elements. First of all, tobacco companies and ultra-processed product companies are using interference tactics and tactics to promote their products similar to the ones used in prior crises. In the case of tobacco companies, for instance, they pose as model corporations while promoting their products and obstructing as much as they can regulations on this matter around the world and at a national level. In the case of UPP industry and non-alcoholic beverage companies, something we have seen is a broad spectrum of interference that goes from the donation of harmful products to support for state emergency measures, for instance, through the donation of medical equipment or money to carry out public health activities within the context of the pandemic in specific territories. It is worth drawing your attention to something that is of the utmost importance and has to do with CSR, which is that it is not only geared towards cleaning the image of companies and brands, but also to open the door to a powerful influx by these companies at decision-making instances, intended in some cases to block public policy initiatives or regulations that affect them, something we have seen, for instance, against almost all over the world to install against installing an FOPL system warning people about the risk of consuming ultra-processed products. And finally, I would like to mention that international policies that have indicated great progress regarding public health and human rights, like the Framework Convention for Tobacco Control. Despite this progress, the industry has found ways to bypass the regulations in its corporate actions. I hope that with these points around the problem of interest that brought us here today, as well as the corporate practices and some features of these practices, we may be able to hold an extremely fruitful discussion, which is also necessary and very important at this point. Thank you very much.
We'll hear from experts from different countries. We will hear from Deborah Rosen. She is a CTFK representative, and she will present an overview on how the big tobacco efforts exploited COVID-19. From managing political campaigns in the field to strategic consulting for an international issue advocacy organization, Deborah Rosen's 20-year career has focused on finding unique strategies to hold policymakers and global corporations accountable for abusing human rights, labor rights, public health, and the environment. Her work has been featured on CNN, Fox News, and in PR News as examples of innovative viral marketing strategies on behalf of NGOs. Deborah currently heads up Take Apart, the tobacco industry corporate campaign strategy for the Campaign for Tobacco-Free Kids. Then we will hear from Ramona Brad, 2035 Tobacco-Free Romania, on corporate social responsibility efforts in Romania and how the organizations mobilized to counter tobacco corporate social responsibility. Ramona Brad is a medical doctor with a PhD in dentistry. She is currently the project director of the 2035 Tobacco-Free Romania initiative, where she oversees the first national comprehensive tobacco and gaming campaign. In 2015, she spearheaded the Romania Breaks Coalition's first successful effort to pass a national smoke-free law. In 2016, Dr. Brand also worked to secure adequate implementation of the European Union Tobacco Products Directive and went even further to advocate for Romania's right to introduce plain tobacco packaging. Today, she continues to lead the campaign to fight against tobacco advertising, promotion, and sponsorship, including for new heated tobacco products. Then Lilia Oliver, Advocacy Center Live, Ukraine, will present on the industry use of the pandemic as an argument to fight against tax in Ukraine. Lilia Oliver is the executive director of the NGO Advocacy Center Live since 2019. Lilia and her team are advocating for the implementation of the WHO Framework Convention on Tobacco Control in Ukraine, aiming to increase tobacco taxes, adopt a complete ban on tobacco advertising, promotion, and sponsorship, and comprehensive smoke-free legislation, conducting mass media campaign, and exposing combating tobacco industry interference in public health policy. Lastly, we'll hear from Eric Antonio, Salud Justa, Mexico, on the industry efforts to fix pricing and market products during the pandemic. Eric Antonio has a degree in political science and a master's in administration and public policy. Eric has participated as the coordinator of advisors to the presidency in political and parliamentary process from 2003 to 2009 in the Congress of Mexico City. From 2010 to 2018, he was the director of Initiative for Tobacco Control at the Inter-American Heart Foundation in Mexico, and currently serves as the director of Salud Justa. Deborah.
Thank you so much. So for decades, tobacco companies have exploited crises to advance their business objectives, from natural disasters to public health crises to crisis moments in social change movements. Tobacco companies have found ways to use these moments to their advantage. And I think that is really important context for what we have seen from the ways tobacco companies have exploited the most recent outbreak of the COVID-19 pandemic. While the execution is relevant to this moment, the tactics are part of a well-worn tobacco industry playbook. So today, I want to talk about the tobacco company tactics we have observed around the globe exploiting COVID-19, which have largely fallen into four categories: spreading misinformation, using COVID-19 for product promotion, corporate reputation promotion, which tobacco companies will characterize as CSR, and lobbying. The majority of examples that I pulled in the following slides were observed in several countries. So it's not meant to be necessarily comprehensive, but illustrative of what we saw in several places. So let's go to the slides. The first tactic that we caught in our monitoring really early on in the early days of COVID-19 was the spreading of misinformation. Fact, COVID-19 attacks the lungs, and behaviors that weaken the lungs put individuals that contract the virus at greater risk for negative outcomes. Just when the virus was spreading through China in December 2019, misleading research implying that smokers were less likely to be infected by COVID-19 was being shared by tobacco industry-friendly accounts on a Chinese social platform called WeChat. Public health advocates in China were able to work with government to shut down these threads and the popular accounts sharing these messages within weeks in China, but the activity really foreshadowed what we would see in subsequent months. So this article from authors with links to the tobacco industry was one of the most cited by tobacco and vaping businesses and advocates, with this specific line that I've highlighted here, cherry-picked and often taken out of context. This paper and a couple other papers, many of which were sort of presented as research papers that were not necessarily peer-reviewed or didn't go through peer-reviewed channels, were referenced in scores of media articles. Many were in publications with financial ties to tobacco companies that targeted smokers and vapors, like Filter, and some were in highly credible outlets like WebMD. And these articles really over several months confused both smokers and vapors and put them at increased risk. We also saw this type of misinformation campaign leveraged in product promotions like this one, with the egregious claim that using this e-cigarette would, quote, keep the pulmonologist away. Here's another example. So there's some newer nicotine products, these nicotine pouches from British American Tobacco, this one in particular. We're just starting to promote their products at the beginning of just before the pandemic, and then incorporated the misinformation and this opportunity into sponsored stories like this one in the Czech Republic. So note the line, I highlighted it just under the image on the left, suggesting, quote, maybe it is time to look at nicotine alternatives that do not burden the respiratory system. This article came out around the time that information that public health officials were spreading, were trying very hard to get the word out that any behavior that compromised the lungs could put individuals at greater risk for a negative COVID-19 outcome. We saw a variety of different types of product marketing referencing lockdown themes. The one on the left here for Vape, which was an e-cigarette from British American Tobacco in Mexico, had a whole bunch of advertisements focused on staying at home and using Vape as part of your stay-at-home routine. This other one, Pakistan, in the center of the slide, was for a nicotine pouch called Velo, also from British American Tobacco, and referenced the sort of working from home experience. This one, now we wouldn't have caught this had someone not shared it, but we found that Philip Morris, who makes a heated cigarette called IQOS, was actually texting people in this example in Lebanon, encouraging them to get their friends and family to sign up on wait lists to be able to get the new IQOS when stores were able to open. Here are a few other examples. Again, this one from Vape, e-cigarette from British American Tobacco on the left in New Zealand, encouraging folks, if you're spending time at home, why not use Vape? This one was, I believe, in Greece for the British American Tobacco's heated cigarette Glow. We also saw a variety of other sort of activities around these products. So certainly incorporating references to staying at home. We saw online virtual concerts sponsored by tobacco brands and e-cigarette brands. This one was in Azerbaijan. Here's another one again. This is Lyft. It's another nicotine pouch. This one in Kenya. Again, at around the same time, referencing the idea that you're staying at home. And maybe in this one, a couch potato, promoting this nicotine pouch. Again, another one. Now, what we also started to see was advertising that started to incorporate other COVID-19 related themes. This one, the mask, personal protective equipment. We saw tobacco companies brand those masks and use them in advertising, and not only use them in their sort of advertising, but use them as like product giveaways with tobacco products. So you can see here's one in Kazakhstan promoting free giveaways of hand sanitizer and masks with the purchase of a Glow, which is a heated cigarette from British American Tobacco. Here's one in the United States, again, also promoting giveaways of personal protective equipment with the purchase of their products. And again, another one here also in the US, promoting free giveaways of hand sanitizer, masks with the purchase of products. We also started to see promotions for discounts, as well as either discounted or free delivery of tobacco products. Those promotions were happening on being spread on social media, as well as on the product homepages. This one used a 19% off discount for their products. This one for IQOS, heated cigarette, in Canada used this as an opportunity to circumvent age verification laws, noting that they would go ahead and deliver heated cigarettes through contactless delivery, and we're waiving age verification ID checks for delivery. We also saw, as Juan talked about, reputation promotion from tobacco companies. This was probably the thing that tobacco companies really wanted to call attention to was any type of philanthropic effort that they were engaged in. We saw this all in several countries. One other sort of interesting sort of corporate brand promotion that tobacco companies engaged in, particularly Philip Morris and British American Tobacco, was marketing the idea that that they were going to investing in research for vaccines for COVID-19 and using tobacco plants for those vaccines. And finally, we saw a spate of lobbying efforts. There were several efforts to push to keep vaping stores open, to make them essential businesses. You'll note I put an arrow here that much of this lobbying referenced some of the misinformation that we talked about earlier. This is a reference to the article from Dr. Farsalinas that we saw earlier in this presentation. Other examples of efforts to sort of push to get tobacco companies, both the manufacturing as well as the sales, classified as essential businesses that could be remain open during lockdowns. The last sort of example on the lobbying that I'll show here would be several tobacco companies use this as a moment to try to delay different regulatory processes, whether that was the implementation of new policy or seeking to delay hearings on policy. We saw many tobacco companies in several countries try to use this moment to slow public health policy progress. And I think that that's it. So I'm going to turn this over to my partner, Ramona Brad.
Thank you very much, Deborah, for the kind introduction and for the very comprehensive overview of tobacco industry tactics around the world during the COVID-19 context. I will try to further exemplify through Romania's examples the same tactics that were used by the tobacco industry in Romania during the COVID-19. I think that we are somehow clear that during the best of times, tobacco has been identified as severely impacting health and development. But during an unprecedented COVID-19 pandemic, tobacco and the actions of the tobacco industry are even more of a blight to any society. The principle already incorporated into the WHO FCTC of the irreconcilable conflict between the tobacco industry and the public health objective has come across probably more prominently than ever during the pandemic. The actions of the tobacco industry during the pandemic, I don't think are new by any means. What is new is the sense of an even larger cliff between the tobacco industry actions and the public health, or if you want, a stronger sense of a larger ethical and moral gap in such a context. Romania has seen a wide array of tobacco industry tactics during COVID-19, probably all of the ones that Deborah has already mentioned in her overview, out of which I selected the ones I think are the most concerning ones when talking about public health objectives. Derailing the scientific debate, in itself an old tobacco industry tactic, has come across even stronger during COVID-19 through the intentional push of non-peer-reviewed studies and confusing research meant to create controversy about nicotine and the smoking impact on COVID-19 patients. I included this chart here as I think it captures perfectly what the output, in between commas, of such actions are. It shows a public sentiment around smoking, vaping, and tobacco industry during the first 6 months of the pandemic. And it shows, unfortunately, how we have lost an opportunity for general public awareness and education at a time of utmost concern, an opportunity which the tobacco industry didn't hesitate to grab and to exploit, obviously, to its advantage through manipulation and misleading research. The images portray few of the media reflections resulting from the tobacco industry actions in terms of derailing science in Romania. They focus on the nicotine controversy, which you have heard from Deborah as well in other countries, and on the so-called potential benefits of the smoker status on getting infected with COVID-19. Corporate social responsibility has represented the second largest set of strategic tobacco industry actions during COVID-19 in the country through a wide variety of partnerships with either public health institutions, like the attempt from VAT to conclude a partnership with the Ministry of Health, an attempt which we have managed to block a civil society, as that would have created a precedent in Romania, or the hospitality industry partnerships, or the well-known relief type of NGOs. By far the most appalling such partnership in Romania was the one concluded by PMI with Red Cross. In a country where the monetary toll of tobacco use reaches $5 million only in direct medical system costs, and with a death toll of over 36,000 people annually due to tobacco use, PMI has donated €1 million, to the Red Cross at the onset of the pandemic, with a specific purpose of purchasing ventilators and protective equipment. In this specific NGO case, it is important to highlight that Red Cross Romania has been in flagrant breach of its own set of policies that prohibit tobacco industry partnerships. Also, the Red Cross Romania has been in breach and failed to admit of its process of aligning, if needed, exceptional type of partnerships with its headquarters at the International Committee of the Red Cross. Important to note also that the International Committee of the Red Cross is an observatory to the WHO Framework Convention on Tobacco Control. Through engaging ICRC and the WHO FCTC Convention Secretariat, we enabled a commitment for not repeating this type of partnerships at any point in the future. And we also managed to obtain a commitment not to further promote this type of partnership in the public space. I will end my 5 minutes short intervention in this webinar and in this panel by quoting a famous Romanian marathon runner, Tibi Ușeriu, who at the end of one of his tough races through the Arctic region was asked whether it was tough. He replied by saying, anyone can do easy tasks. So I do believe that all of us engaging in tobacco control or food policy advocacy through good times or more challenging ones like the COVID-19 pandemic, we all are definitely up to the challenges in front of us. I hope that the exchange of learnings and best practices during such times represent enabling tools for achieving our policies related objectives across the world. While thanking you very much for the opportunity to present some Romania examples during this panel, I'm very pleased now to pass the virtual floor to my colleague in Ukraine, Lilia Olefir.
Hello, my name is Lilia Olefir. I am the Executive Director of Advocacy Center Live from Ukraine, and I will be talking about industry use of pandemic as an argument to fight against tobacco tax. In 2020, the tobacco industry in Ukraine tried to decrease excise duties on tobacco products. Tobacco industry used the following tactics to overturn a tobacco tax reform in Ukraine, such as direct lobbying using front groups and decision makers to influence the Ministry of Finance and Parliament Tax Committee, paid media, false research, registering bills, and making amendments to unrelated bills over the night to secretly reduce taxes on heated tobacco products. Tobacco industry used carrot and stick approach to reduce excise on heated tobacco products by threatening government with international investment court, increase of illicit trade, closing production, reduction of revenues, and losing potential investments. At the same time, tobacco industry donated more than $400,000 to fight COVID pandemic in Ukraine. PMI issued a guarantee letter for the Ministry of Finance, promising to pay in advance $171 million, the potential revenues from the excise on heated tobacco product sticks in exchange for Parliament decision to reduce tax on heated tobacco product sticks. PMI director himself came to Ukraine to meet the president of Ukraine, Volodymyr Zelensky, and to convince him not to increase taxes on heated tobacco product sticks. In order to protect tobacco tax victories, NGO Life, together with partners, conducted advocacy campaign to protect tobacco tax reform by gathering and using evidence and messages strategically, partnering with influential research institution, Kyiv School of Economics, to conduct the advocacy research, partnering with the WHO and promoting the WHO research findings, engaging the World Bank, opinion leaders, and media, engaging policy champions to call Parliament to reject tobacco industry amendment on excise duties reduction, and exposing the tobacco industry false claims, lobbyists in the government and Parliament, and tactics used by promoting in the media the interactive infographic that shows how tobacco industry acts and what they do to compromise tobacco taxation policy that saves lives in Ukraine, and exposing how tobacco industry aggressively markets and sells heated tobacco products to kids through viral social media campaign conducted by young people themselves. Lessons learned for us is that mapping the government to expand the coalition of supporters is important. Same, working directly with policymakers, providing them with evidence, catchy messages, publicity, and being available 24/7 to support them. Developing and promoting advocacy research. Use-driven social media viral campaign to show how tobacco advertises novel tobacco products. Engaging World Bank and World Health Organization. Strategic communication to build the consensus and call out the tobacco industry. Developing and sustaining new partnership with influential economists, famous doctors, opinion leaders, and media to sustain civic pressure for annual tobacco tax increase in Ukraine. And of course, rising awareness among decision makers that tobacco taxation works, and it's a win-win strategy. Thank you for your attention.
Thanks, Lilia. Now we'll hear from Eric Antonio Ochoa from Salud Justa, Mexico.
Hello, good day. I'm Eric Antonio Ochoa, General Director of Salud Justa MX, and I will be speaking about the efforts conducted by the tobacco industry to fix prices and market products during the pandemic. I will focus on the strategies we have seen in the past months in Mexico. The first one, which I believe is shared with other types of industries, is misleading the public. In the case of Mexico, we have found publications and even some paid insertions where they claim that smoking is not a risk factor linked to COVID, although it has been proven that it is. It increases the risk of becoming severely ill almost twofold, and among young people who have double consumption, it can go up to 7 times. On the other hand, they have disseminated via large media outlets a study which concludes that among those people hospitalized with COVID-19, on average, there's a lower number of smokers, for which reason it is attributed a protective effect from nicotine. This study, reviewed by peers, has been found to have numerous weaknesses. On the other hand, the tobacco industry intends to be or wants to sell itself as part of the solution, and they seek to create a positive image, publicly announcing that they are committed to the development of vaccines against COVID-19. Especially in the case of Mexico, marketing actions are underway allegedly as CSR efforts. In both entities where Philip Morris and British American Tobacco have their headquarters, Jalisco and Nuevo León, respectively, they have delivered medical equipment, PPE, as well to physicians and to the entire medical staff. And they have held public events that we have documented and denounced. The third strategy is to use lockdown to promote new products. In the case of Vipe, they have predefined combos where you are able to select the quantity of products. You can choose the flavors and the levels of nicotine. Vape contains products with nicotine salts which are much more addictive. At the end, you are given an automatic discount. In the case of Philip Morris Mexico, they have a loyalty program where if you are a smoker and you already started using IQOS, which is the new product they are promoting, and if you convince a friend or a relative to also use IQOS, they give you and the person you convinced a gift of 600 Mexican pesos, which is the equivalent of $30 as a discount for your next purchase. Strategy number 3, which is of the utmost importance, is the reduction of prices. The greatest reduction we have seen of the products is the one that pertains to vape, where a device with a cartridge, which at the beginning of the pandemic had a cost of around $30, now costs $5. And this is capitalized very well by the tobacco industry. They also increased home delivery services. In Mexico, we even detected that Philip Morris, if you added your personal information on the webpage of the new product, IQOS, they could send a demonstrator to your home who could lend you the device so that you would keep it for 2 weeks. At the end, you would receive a discount of about $20 for the purchase of your first IQOS kit, including both the cartridge and the device. This we also found to be quite unfortunate because of the promotion of this new product. In the case of Mexico, this is a product that is legal, but its marketing does not meet all of the requirements yet. There are no specific taxes on this product. And in the case of a vape, for instance, since it's an electronic cigarette, it is currently banned by the legislation in force. There is another strategy where, especially in the case of IQOS via Facebook and email, they used the main message from the federal government. The main message from the federal government was stay home. In the case of IQOS, they came up with the messages, care for yourself, we care for you, or reasons to stay home. This is a strategy 6, a campaign that they started disseminating in September last year, but they have maximized the campaign this year. In the first months of 2021, Philip Morris displayed an artistic mural with about 30,000 lighters, where each lighter represents a smoker who presumably stopped smoking to start using IQOS. This mural was displayed in the Carso Square, one of the most important squares of Mexico City, whose owner is Carlos Slim, the wealthiest man in Mexico, and until 2 or 3 years ago, the Director of Regulatory Affairs of Philip Morris International. This man is still meddling in the industry. Finally, I would like to give you my personal information if you have questions or comments about my presentation. Don't forget that in July last year, our organization, Salud Justa, together with 5 other national organizations, in addition to regional and international partners, published a study on unmasking the tobacco industry in Latin America, a regional report with 6 countries. I leave you with the link and feel free to contact me. Thank you very much.
Now we're moving to our second part of the session, which is related to how the big food and big soda companies undermine public health during COVID-19. For this session, we are going to hear from speakers from around the world, and we will be listening from Holly Wong from the Global Health Advocacy Incubator on the food industry tactics update on the Global Health Advocacy Incubator's COVID report. Holly Wong leads the food policy program and also provides a strategic direction to our efforts to improve the health and nutrition policy environment in key countries. Holly brings more than 25-year experience in global health, spanning policy, research, and advocacy. Prior to joining Global Health Advocacy Incubator, She served as an appointee of the Obama administration, a leader of policy program at public and private sector health groups, and a health economist with international development and health policy organizations. We're then hearing from Simón Barquera from the Instituto Nacional de Salud in Mexico. He will be sharing with us some lessons learned from industry interference in the front of package warning label implementation in Mexico. Simón Barquera is a medical doctor with a PhD from Tufts University in Boston in the United States. He is a member of the National Academy of Medicine and author of more than 350 scientific publications and a book. He has received numerous awards from University Pajo and the Mexican government for his work in developing public health policies. He currently serves as director of the Center for Research in Nutrition and Health of the National Institute of Public Health. We will be then hearing from Sara Rybakovi, Center for Science in the Public Interest in the US. She will tell us and share with us a case study on monitoring youth targeted marketing, removing advertising from online learning platforms in the United States. Sara Rybakova is a senior policy associate at the Center of Science in Public Interest, focused on reducing unhealthy food marketing to children and improving the nutrition quality of food for children in restaurants. Prior to joining CSPI in 2015, Sara worked for the Food Recovery Network, a nonprofit working to reduce hunger and food waste. She is currently a graduate student at Georgetown University, where she is pursuing her master's degree in business administration, focused on responsible business practice and non-market strategy. She earned her BA in public health from the University of Rochester. And finally, we will hear from Carolina Piñeros from Red Papás in Colombia, and she will be sharing with us the civil society organization's response to corporate behavior by Big Food in Colombia during the pandemic. Do not donate junk food. Carolina is an industrial engineer with a specialization in personal and family development. She was one of the founders of Red Papás from the La Montaña Parents Association in February 2003. Since April 2004, she has served as the executive director of Red Papás, and before she was engaged in multiple diverse activities related to social work and service. Now I'll give the floor to Holly. Holly.
Great, thank you, Lorena. So now we're moving from tobacco to ultra-processed food and beverage products, but we're actually going to see the same story that you just heard from our colleagues on the tobacco side. So almost exactly 1 year ago, in March of 2020, as the pandemic hit, we began to see examples of food and beverage companies responding through marketing and through what might be considered as good deeds. But many in the public health community watched with alarm as we saw that many of those industry good deeds were really not just a traditional response to a disaster, but in fact, they were capitalizing on COVID and using it as an opportunity to sell more of their products, their unhealthy products, and also to build the narrative around big food, their products, and especially their role in public health. So with our partners from the Bloomberg Philanthropies Food Policy Program, we collected almost 300 examples over a 5-month period from 18 countries. This was not meant to be a comprehensive study, but just a limited sample. But we saw very consistent patterns across countries. So it was not just an action or two, it was broad strategies by these global companies. So in terms of the findings in the report that we published last November, big food companies were using COVID and actually worsening the epidemic of obesity and diet-related diseases that already existed. They did this through deceptive marketing. These companies positioned themselves and their products as essential to the relief efforts. In some cases, they deceptively marketed their unhealthy products as boosters for the immune system. And they misled the public by confusing the terms healthy food with food safety. The food and beverage industry also used corporate social responsibility actions to reach out to governments and to present themselves to the public as an ally and as a legitimate voice on health issues. In many cases, they used cause marketing campaigns to encourage the consumption of unhealthy products by linking them to charitable causes. Companies also donated food and other items to needy communities, to frontline workers, to food banks, and to government relief programs. Now, for vulnerable populations already experiencing different forms of malnutrition, their health circumstances were only aggravated by free fast food, sugary drinks, and junk food. And then lastly, while companies were showcasing their corporate social responsibility initiatives and their public-private interactions to the public behind the scenes, they were often lobbying against healthy food policies. So since last November, when we launched our report, sadly, the COVID situation has persisted, and we've continued to see similar practices by the food and beverage industry. In terms of some of how they've promoted their goodwill. In Mexico, for example, Coca-Cola has claimed to preserve and guarantee access to water for thousands of Mexicans. But research has shown that the company uses water in each of the country's 32 states, from which it draws more than 55 billion liters of water per year. The map here shows different points in Mexico where Coke and other junk food industries extract water resources. Last year, food and beverage companies were arguing that their products were essential, and they fought to keep their manufacturing plants open despite the lockdowns. Now they are arguing that their employees should be vaccinated urgently, more urgently than anyone else, so that operations can continue and their products can remain on the shelves. In Colombia, the industry group Fanalco has been pushing for vaccines for these employees, and in Brazil, Coca-Cola posted this Instagram photo showing that the food and beverage industry is working to keep its products on the shelf. We've also seen continued threats and through targeting of children. Nestle has continued to donate ultra-processed products and has partnered with government agencies to have a presence in schools, including, for example, this program Active Vietnam, where they've partnered with the Ministry of Education to promote school sports and make sure that their products are in schools. Nestle for Healthier Kids, which is a global initiative with a strong presence in Latin America, also includes nutrition education in schools. Its main focus really seems to be an advertising opportunity, encouraging kids to cook with their parents, which seemingly means cooking with candy products. And though the program encourages kids to eat more fruits and vegetables, the focus seems to be on fruits and vegetables incorporated into ultra-processed products. So during the pandemic, many companies, of course, redirected their marketing strategies, and many capitalized on the COVID pandemic itself. Coca-Cola's Share a Coke campaign is dedicated to holiday heroes, healthcare providers, first responders, educators, certainly people that we owe thanks to, but maybe not an unhealthy product. In Guatemala, Nestle launched the promotion Back to School with Mickey and Friends, linking its ultra-processed cereal products to school supplies for children. But most importantly, we've seen a continued threat through interference in the policy process. In Uruguay, the front of package nutrition warning label policy was scheduled to go into effect on February 1 of this year. Just days prior to that, the decree and the regulations were modified to change the nutrient profile model and the cutoff points. These changes were implemented by the Ministry of Industry on behalf of its stakeholders without any public consultation or discussion with the Ministry of Health and without any scientific evidence supporting such a policy change. In Mexico, with the new front of package warning label regulations, cartoon characters had to be removed from packaging. So the Bimbo cartoon, this little bear, was removed from the packaging, but the company was able to skirt this regulation by placing the character directly onto the food product itself. And then lastly, in Argentina, where a law on front of pack warning labels is moving forward, industry is now pushing back even more strongly than ever, criticizing those regulations as blaming individual foods without examining how they fit into a broader balanced diet. So what are the implications of industry's efforts to build their image through donations and corporate social responsibility? Recently, Edelman, the public relations and marketing firm, surveyed consumers and found that business is more trusted than government, NGOs, or media. And business is expected to fill the void left by government. And very worrisome, business is now seen as the only institution that is both competent and ethical, which apparently doesn't apply to government or NGOs. So it's been seen by the public and by policy in the last year was big food as the good guys. We recognize that many of the things that corporate partners did in some value during an economic crisis and a public health crisis. But we also have to look below the surface to understand that industry was leveraging their resources and their power to position their products, their brands, and to build their public image and reputation. First, companies polished their good corporate citizens while actually contributing to unhealthy diets and non-communicable diseases. COVID brought additional risk for those living with NCDs. Marketing and donating of junk food only aggravated the health crisis that already existed. Second, big food portrayed themselves as public health partners and experts, establishing themselves in government's role and positioning themselves as having a legitimate voice in public health policy. But in fact, they were building their political influence to help them push policies that serve their own interests and not those of public health. So what can we do here? How can we protect public health while still responding to a public health emergency? Three things. First, have protocols in place to help regulate the kinds of donations that are appropriate during these kinds of emergencies. Second, implement evidence-based healthy food policies that address the epidemic of diet-related diseases that we see. For example, through front of package nutrition warning labels to give consumers better information. And third, we need to ensure that the process of making health policy is free of conflicts of interest. Industry is a stakeholder and they can have a voice, but they should not be able to inappropriately influence government policymakers. So thanks very much. I'm going to stop there and turn it over to Simon Baquera.
Thank you very much, Holly. It was a great presentation. And I would like to thank the Global Health Advocacy Incubator for the wonderful opportunity of sharing in this satellite symposium of the CUGH a perspective of what has been happening in Mexico with implementation of the front of package warning label. That is a strategy that is one of the key components of an obesity prevention policy in Latin American countries. The next, please. Let me start by saying that Mexico is facing a national emergency due to non-communicable chronic diseases, which represent 80% of all deaths. We have 100,000 deaths only from diabetes, and 40,000 deaths are attributable to sugar-sweetened beverage consumption. We are one of the countries with the highest consumption of ultra-processed foods, and this represents a huge cost to our nation, more than 6% of the gross domestic product. Since very early in 2007, a joint report with the Institutes of Medicine of the United States and my institute concluded that front of pack labeling systems are a powerful tool to improve and to guide consumer choices to healthier choices. And we started working since then on different options. However, in 2010, food industry developed the GDAs, these symbols that you can see here, and they started promoting them and lobbying them very strongly among decision makers. And they started using them as a voluntary tool in their front of package labels. By 2011, we proved that this system was misleading and it was not well understood even by nutrition college students. And in 2014, Chile developed a very interesting and creative warning labeling system, black octagons warning of critical ingredients. And at the same time, in Mexico, the industry promoted GDAs where became mandatory by the norms. So this was very worrying for academia, because we were consistently finding that they were not well understood. In 2016, the government declared an epidemiological alert, and we show in a multi-country study that the Chilean warning labels were well understood by children of 4 countries. So in 2018, we informed a national experts committee that recommended the government to replace the industry-promoted GDAs by a system similar to the one in Chile. And in 2019, with the change of government, we were able to promote and change the laws and also the norms, so that a warning label system was approved and started in 2020 in the first stage. And you can see here our labeling system. It has 5 octagons for calories, sugar, fat, sodium and trans fat, and also it warns about non-caloric sweeteners and caffeine products for children. And you can see here the implementation is very easy to see in unhealthy products, and this is something we are very happy about. As Holly mentioned, there are some strategies with which industry is going around these regulations. And but this system will help consumers make healthier choices, and we think this is going to happen very soon, and we will going to be able to evaluate it like Chile did. And we are already seeing how hundreds of products are being reformulated to decrease the number of warning labels in their products. So we identified many industry tactics. It was a very complex process. It took more than 13 years to have this implemented. And in the legislative level, there was a very aggressive lobbying during the general law process, including forums, hiring sponsored studies, events, and experts from other countries to say that the warning labels were not good for the economy and not with proof that they were going to work. Also at the executive level, there was opposition in the regulatory process at very high levels. CEOs of companies such as Coca-Cola visited the president and talked about the opportunities for the country for development. And at the judicial level, there are more than 60 legal procedures right now against this warning label. Most of them come from the transnational companies. And also at the civil society level, there is an important discredit and public threats to the people that is working, supporting this initiative, and they are taking advantage of the current polarization of the society with COVID and etc. to criticize this as an ineffective action from the government. We were having able to neutralize this with different reports, with an ethics code with the academia, inviting professionals to become interested on having evidence-based policies and not involved in sponsored studies, events, or policies. And also we have documented this in high-level profile journals and books. So to conclude, I think the success until now in Mexico has been a very coordinated response between government, academia, and civil society. This is not always the case, but in this administration we have had a window of opportunity, and obviously the support from international organizations such as the WHO, UNICEF, etc. is very important, and also from other countries in the region that have similar experience. And I would like to conclude saying that in my experience and in these last 13 years, we are coming to the conclusion that the single most important challenge to obesity prevention programs and policies in Mexico and maybe in the world is interference of industry, health policy, and regulatory efforts. We have many opportunities. One of them is to build a culture of ethics and awareness among professionals, and to be aware that these solutions can be replicated in low and middle income countries. Our code of ethics, the Nutrition Code, is something that we expect to become international and to work in other Latin American American countries. And we know these solutions do not need expensive technology. These are not vaccines, but are equally effective to improve health. And with this, I finish my presentation. And now I would like to pass the floor to Sarah. Thank you very much.
Hi, and thanks for having me today. I'm Sarah Bakov, and I'm a Senior Policy Associate at the Center for Science in the Public Interest. CSPI is America's food and health watchdog. We focus on food and nutrition policy in the United States. Today, I want to talk to you about a specific category of food and beverage marketing to children that we've grown increasingly concerned about during the COVID-19 pandemic. Nearly a year ago now, schools transitioned rapidly to remote learning. This required students and teachers to adapt quickly. With this transition, digital education platforms, including websites and apps, became a critical component of the virtual classroom environment. These digital education platforms, to which students often gain access to on school-issued laptops and devices, are not new to the school setting. They are an important part of how children learn and are already a mainstay of our education system in the US. However, with the surge in usage of these programs comes concerns around increased exposure to junk food marketing. Food and beverage companies were already well poised to profit from the move to virtual learning. Schools should be a safe place for children to learn free from advertising, regardless of if learning is taking place physically in the school building or at home. You can see here 2 examples of the types of ads accompanying some of these digital learning platforms. An analysis done in June 2020 found that approximately 60% of these platforms either contain ads or lack clear advertising policies. And many of those ads are troubling. As we all know, marketing affects children's food and beverage choices, purchase requests, diets, and health. Children are uniquely vulnerable to food and beverage marketing as they are often unable to comprehend either advertising's persuasive intent or the long-term health consequences of their food choices. Another concern CSPI has around the use of these education platforms is the potential variation in exposure based on ability to pay. Some of these platforms offer advertising-free versions of their sites with paid subscriptions. However, not everyone can afford such fees, potentially leading to differential exposure to junk food advertisements by socioeconomic status, which may exacerbate socioeconomic and racial health disparities. I'd like to wrap up by talking about what CSPI has done alongside our partner organizations to try and address these concerns. Over the summer, we reached out to a few companies we had seen running ads on these platforms and urged them to stop. All 3, each of which participates in the industry's self-regulatory body in the US called the Children's Food and Beverage Advertising Initiative, or CFBAI, agreed to pull their ads from the specific site referenced, with a varying degree of commitment to other similar sites. We also reached out to CFBAI and pressed for all 19 member companies to avoid advertising on these sites. They agreed, which was a good first step, but the commitment only covered companies that voluntarily participate in the program and only lasted until the end of 2020. We've since gotten the commitment extended through the end of the 2020 to 2021 school year, which ends this summer. However, CSPI and our partners remain concerned about the lack of transparency in the self-regulatory commitment and its temporary nature. We know that at some point, when it's safe, all children will be able to return to their schools. And when that happens, we expect these digital platforms to remain a large part of the school curriculum. We need greater transparency from companies and CFBAI and a permanent commitment. There's also a pretty clear-cut role for the United States Department of Agriculture. The USDA already has school wellness policies that limit junk food advertising on school grounds. We have sent a letter to USDA urging the agencies to adjust to the ever-evolving pandemic and the increased emphasis on remote learning. The agency can do this by issuing guidance clarifying that local wellness policies also apply to school-issued computer equipment, all remote learning digital resources that serve as curriculum material, and digital material that aligns with standardized educational criteria. As a next step, we're encouraging supporters in the US to sign on in support of action from USDA. If that's you, you can access more information at the link I've included at the bottom here. The Center for Science in the Public Interest believes that it's possible to create a safe online learning environment that's permanently devoid of unhealthy food and beverage advertising. I've included CSPI's website and my email here again at the bottom in case anyone would like to connect directly. I'll now turn it over to Carolina Piñeros. Thank you.
Thank you very much for the invitation to participate in this important conversation. I will be sharing some actions by civil society organizations in Colombia during this time. In Colombia, on March 23 last year, lockdown was decided by the government, and that's when we started seeing, as many journalists mentioned, that the ultra-processed product industry decided to wear the cape of heroes, as Holly mentioned a while ago. It's a practice that took place in many places through different ways. One, through the government itself, who in many cases lent itself so that these companies could position their brands and their products as saviors of vulnerable positions back then by advertising even over government-owned platforms, and in some other cases, through the campaigns of these industries. CSO organizations decided back then to monitor government decisions and industry actions. We also tried to understand that there were some international recommendations from UNICEF, from FAO, and from the UN. And on the other hand, we requested to research these companies by participating companies in these campaigns. We also challenged the state in this regard. What specific actions were we able to undertake? We activated a digital strategy called Do Not Donate Junk Food. The campaign, which promotes the junk food law in Colombia, is called Don't Eat More Lies in Colombia. So in this sense, we continued along the same lines when we started telling the industry, do not donate junk food. In addition, based on these international recommendations, we had a protocol for donations, which was intended to be given to the national government and to subnational authorities in the different regions of Colombia to, in fact, be able to know about the types of donations were allowed to be given to the populations and which were not. And the government and the Ministry of Health specifically, based on this, issued some guidelines, some recommendations, not exactly the way we would have wanted it to be carried out, but in any case, some guidelines were issued which somehow started focusing on what could be delivered via donations to the different regions. In addition, the control bodies were so we made denunciation before national control bodies and international agencies. I will give some examples of what happened in Colombia. Here we have what we were able to post via social media. This is a specific example. Red Papás, in this case, was denouncing through its media a donation of a formula called Enfagro as part of a strategy for sales purposes. FIAN Colombia as well, via their social media, was acknowledging the truth about donations and contributions by the sector of peasants and farmers in Colombia. Another civil society organization, De Justicia, came up with an article published on the El Tiempo newspaper regarding the inconvenient donation by ultra-processed product companies. And Red Papás, through a whole campaign with media and journalists, we called upon them not to donate more junk food. And this was also driven over social media and over the platforms of different media in Colombia. We are able to see the deployment of the situation over the media. This was denounced by a civil society organization called CUGH in Colombia, who asked the UN to intervene in the delivery of these groceries, which contained these unhealthy products, this junk food. This is just to give you examples of what happened with this strategy in Colombia in relation to don't donate more junk food and how civil society organizations were able to come together around this. Thank you very much.
Thank you, Carolina. Thank you to all the presenters of this great session. We will now like to invite you to open your cameras, turn on your cameras, and also invite you to have a Q&A session between us and some of the main reflections that these presentations raised. The first of the questions that we wanted to ask you is, what are the main commonalities that you identify between the big food and the big tobacco during the pandemic? You already shared with us different strategies, and we would like to explore with you what are those commonalities between these two companies. Maybe Simon, you would like us to start the discussion, as you have a strong experience with tobacco, but also with the food industry.
Oh, thank you, Lorena. Well, I think for us in the food component, it has been great to learn from the experience of tobacco, and it is almost a carbon copy of what has been happening in Mexico. What I see is a lot of discussions at a very high level. So it doesn't matter if you are doing the things through the law and the natural process. They are used to talk and discuss this, their agendas of interest at the highest level, at the presidential level, or with ministries. So it's a huge disadvantage. And the other one that I think is very complicated is their resources to pay and to control the narrative in the media, but also with opinion leaders and with science and in the different policy spaces. So I guess there needs to be some mechanisms such as codes and regulation and to try to decrease the impact of these strategies. And I know there are a lot. These are only the ones that just came to me right now from the question.
Thank you, Simon. Any other comments on the commonalities of these two industries? Anyone wants to share?
I would like to share a thought, if I may. I think what came across very clearly to me, knowing a bit about the food policy advocacy, but also very heavily engaged into the tobacco one, is that the attempts of both industries to get legitimacy during such a context came across very prominently in a way. And I think that it was even more sensitive to address, specifically in the tobacco so-called CSR case that I have presented in Romania, because there was a lot of sensitivities obviously related to the ethical issues. Okay, so how ethical it is for a Ministry of Health, for instance, to give you the Romanian example, to reject a partnership with the tobacco industry, knowing on the other hand that they lacked the equipment that this industry was making available in such a context. So even as a policy maker during such times, it's very difficult to take the right decision if you need to balance the two. So I think what Dr. Barquera has mentioned before, having codes of practices and interference preemption tools already established ahead of such times is helping a bit more in such a case.
Thank you, Ramona. Juan Carlos.
Muy brevemente,
Very briefly, I believe that there is a common element regarding the behavior of the companies from both sectors. And we mentioned this during the introduction to this conference. And it's the fact that increasingly the narrative is worsening in terms of presenting themselves as key and unavoidable actors regarding decision-making on public health and other fields. This is an element that has been increasing. This allows us to see how the business sector is going from a situation which perhaps was on the defensive with respect to the actions of communities, the actions of organized peoples, academicians, and human rights organizations to an offensive role, to the extent that they have created a narrative that is supported by corporate capture, a complete praxis, in terms of the fact that nothing can be discussed around these issues without them being present in that discussion and without considering their voice, in fact, to be able to make those public health decisions. I think this is a crucial element which also traces strategic lines along which they are moving and along which we will also have to go. Thank you, Lorena. I think that there is a common issue, which is the cape of heroes was worn by both industries. And the truth be said, what was happening behind the scenes was something that had to do with advertising. They were promoting their products seriously with the youngest populations, with boys and girls and adolescents, because I also believe that this whole advertising within the digital environment, certainly we have a lot of things that have not been seen that we know nothing about, but it was very serious as well with respect to what happened. On the one hand, posing themselves as helping and saving the population, but then on the other hand, attacking the most vulnerable population with respect to the consumption of these products in a way, I would say, that was concealed.
I think that one other area that I think data is still coming in on is how these two industries really leveraged the move to online commerce and on-demand delivery, both in the way that they promoted their products as well as the way that they made their products available to new audiences. The estimates at this point are that online sales and on-demand delivery businesses had scaled dramatically over the last year. And I think that as we look ahead, one of the things that we're going to have to consider with both of these industries is how regulators are really going to be able to monitor what's happening on these platforms and ensure that regulations that were established in a pre-sort of pandemic, a pre-lockdown world are going to be relevant as we move forward.
Thank you, Deborah. I'm building on what you have all shared with us and this legitimacy that both industries have gained. If someone just listens to what you have shared with us on the donations, on being the heroes, on being the good guys in the middle of a pandemic, for someone that is not so related to these topics, that person would say, well, what is it wrong with these people being the good guys? Why corporate social responsibilities are bad if we are in the middle of a pandemic, and that's something that you, Ramona, shared with us. So we were wondering how we can make clear, or why is it that we consider that this corporate practice might affect public health, and specifically topics related to tobacco control, but also to the promotion of food, if they are donating food, if they are helping people. So I open the floor for your comments, because that might be something that is a little bit confusing. Ramona, would you like to drive us through some of those reasons?
Well, I think you've captured quite well what I've previously said about the way they try to get legitimacy during such a context. Again, I think that it's very difficult to address this issue, to confront this issue during a pandemic context in itself, unless you have a phase already prepared in which you basically enabled you're basically disabled the tobacco or the food industry to get a seat at the decisional table on public health in general. You would be very limited in the ability to do this during a pandemic. What drove the difference in Romania's case, for instance, was precisely the fact that we had a working, ongoing relationship with the Ministry of Health on the tobacco control policies topic, and we are basically able to get the info early and to react early. Again, highlighting a practice that we have constantly highlighted before this pandemic. So, as I said, I think this requires an ongoing effort to basically making clear to the public health decision makers that both the tobacco industry and the food policy industry are not discussion partners on public health topics at any point, pandemic or a non-pandemic context. Other than that, it will the kind of questioning that you've just mentioned, we received it when we basically try to counteract their CSR activities in the pandemic context. And it was indeed extremely difficult to articulate an ethical and a moral reply to such a questioning, basically putting in balance, depriving people of equipment that was badly needed in an emergency situation versus the moral angle of and the ethical angle of this harmful industries engaging. But I think that knowing that we worked with them before and we articulated these concepts and these principles before helped. Although reinforcing again, having a formalized code of practice and rules on engagement of this industry with public health beforehand and ongoing helps tremendously in such situations.
Thank you, Ramona. Carolina?
I think that a difficulty we had in our countries is that for people, it is very hard to understand how these products, for instance, e-cigarettes, these new ways of smoking, as well as these other products which were being promoted and given away to the population, were harmful for their health, when in our countries we lack policies that allow people to get to know if the products given away have excess sugar, sodium, or saturated fat, or in the case of e-cigarettes, that they contain nicotine and they're harmful for health. So they somehow capitalized on this disadvantage, and what they were doing was, in fact, positioning their brands, advertising, many times supported by the governments themselves. So this is when we feel that it was extremely serious for countries like Colombia not to have these policies that would allow people to understand that this product, which was being advertised through the Cape of Heroes, that was saying a lot, that they were saying a lot of things about supporting you and helping you, because this is what the brands were doing, was bad for them during the hardest times for the population. They only had the positive things that they were mentioning, but without really talking about what the products are about. This is why the progress regarding these advances was so important, truly warning the people about the reality of these products, what these products really are, so that they don't reach the population, so that they're only reached by the things that confuses them, by the nice words, the gains. We're here to help you. We're here to support you. We have these campaigns. Even as Holly mentioned, many changed their brands during the pandemic. They stop calling themselves Coke in the case of Colombia, Chocorramo, to be given some other names that so that people could feel that they were kind and close to them during the pandemic. Thank you.
Thank you, Lorena. Another important dimension, similar to what Carolina was mentioning, is not just the lack of controlling of the narrative of the impact of the products, of the consumption, but also how they take advantage of the problem of the perception of the effect of the policies. So they invest a lot of time and experts and money in trying to convey that, for example, the taxation doesn't work, is not effective, is not the way to decrease consumption, or that front of pack labeling or controlling and regulating marketing is not an effective obesity prevention policy. And I think the challenge there is that there is a natural perception of the public that is not studying evidence, of perceiving that some policies do not have effect. I have seen health professionals saying that they feel that the soda tax is not working because they see people drinking soda, and is really a problem to explain them that this is not the way to evaluate if a policy is working. And the same happens, I've seen a lot of people in Mexico saying the warning labels in tobacco did not work, so they are not going to work in food. And we know that the labels in tobacco have saved thousands of lives, and we know that the warning labels in food have an effect decreasing consumption of calories, but we need to be very effective to control this narrative and to disseminate ways in which people can understand the advantage of these policies. Thank you.
Thank you, Simon. And this is very interesting because you all have raised a point that relates to regulations, that relates to challenges that the regulatory agencies or entities have in each of your countries to regulate these industries. And Juan Carlos, you also mentioned during your intervention, and I think Deborah, you also mentioned something about this, about the corporate capture of the state. So why we bring this to the conversation is because, yes, we need to have some measures in place for tobacco and also for food industries. And those that have the responsibility to do so doesn't seem to be fighting that much. And as a reinforcement, we have this narrative from the industry that has misleading information related to the effectiveness of these measures. So based on these reflections, how do you think civil society organizations have a say and an opportunity to fight against or to counter these arguments and to counter these corporate practices, not only with the industry, but also with those governments that might be experiencing some corporate capture?
Hay varias maneras como de tratar de confrontar estas prácticas, pero
Well, I think that there are several ways of counteracting these practices, but one that has worked so far quite well, based on our experience, is to put an adequate framework around the discussion. What is it that you're defending with your discussion? And one of the elements is that we're defending human rights. That's a good framework. We're defending the human right to food, to health, to life, to dignity. And that framework, and this is a conceptual framework, it's a legal framework, but it's also a narrative framework, it's very important to continue strengthening it, to make sure that these struggles and this struggle that is not accidental, but it's so difficult, which is the corporate capture of the governments, that we can face it one way or the other. And I also think that a challenge that we have ahead, the CSO organizations that are in the struggle, is to lengthen the scale, the strategic and prospective analysis scale. I think that the strategic analysis time and the horizon that we're looking at in terms of prospective analysis should be broadened and lengthened. And why do I say this? I say this because we're going into a time, and COVID, which is just the tip of the iceberg, is showing it, we're going into a situation of a prolonged crisis. We're going into a context in which there's going to be one crisis after the next, including ecological and environmental crises related to ecologic collapse, not the euphemism of climate change. No. And this forces us to anticipate the behavior of these industrial sectors, which do strategic analysis at that longer scale, at that longer time scale. And this is a reflection that we must do. We mentioned, for example, the case of water, the Coca-Cola company and water in Mexico. That element, that common good, but it is also a food and a right, water has this triple virtue, is an element based on which we should reflect upon in terms of how to anticipate the behaviors of these industries and in a context of extended crisis. And I finished by saying something very important. And it's that this is no minor topic whatsoever. Within the United Nations system, action frameworks are already being created, which are called prolonged or extended crisis. And this is a horizon that we should promote in terms of thinking strategically on the part of human rights organizations, the academia, and those who defend these struggles.
So I think to your question, Lorena, about corporate capture and how to talk about this, I think what civil society and what public health advocates like everyone here is already doing is trying to draw attention to all of these examples and to provide that context so that people, both the general public and policymakers, can begin to understand that all of those things that companies are doing are not completely those good deeds, that there are underlying motivations, and to begin to expose that and help them see that. I do think that, especially with food and beverage, what we've seen recently is that there are many challenges because of how the general public thinks about these companies. They love these companies and their symbols. I know that in the case of Mexico, with this Bimbo little bear icon, when it was removed, there was this great outcry from adults who remember it fondly from their childhood, and they protested that, you're taking away our memories. Well, that's not what we're trying to do. We are trying to help provide better information to consumers and protect kids from unhealthy products. So I think we do have to be careful on how we message this. We are not against companies as a across the board. We're not trying to bring down these companies. We are trying to solve public health problems. And I think what we're criticizing is the actions that these companies take regarding these products. But we need to be careful how we convey the message, because it is very tricky for all the reasons that that we've talked about here.
Thank you, Holly. And thanks everyone, and thank you to all our panelists for illustrating greatly how these two big food and tobacco companies did a lot of their corporate practices that are perpetuating non-communicable diseases, but that also are undermining policy development. So, and thank you for the attendance to be with us at this time. So I will invite all our panelists to turn on their cameras. We have some interesting questions in our chat that we would like to answer as a team. So we will begin with some of those that we have here. So one of the questions that we're receiving is, and it is based on one of the questions that we saw on the video. It is difficult to make people understand why this is a bad behavior. So the question, the specific question is there any suggestion or advice that you can give us to create sensitive messages around this topic of industry interference and corporate capture and corporate behaviors, given that they are offering solutions? So sometimes it is difficult to create messages for people to understand why this is not so good and why they are not the good guys. So if any one of our panelists wants to give an advice on how to create this type of messages. Carolina, maybe you raised the point of civil society organizations.
Sí, Lore, gracias.
Thank you, Lorena. I was thinking that actually it's a big challenge. I think that the communications are key in all of these topics and in all of these tasks. One of the things that the CSO, those CSO who work for this in the world, we actually fight to ensure that whatever exists from a communication standpoint is very different at this very moment. For example, we're having discussions with different Latin American organizations because many of the influencers, those people who are in the social media, those people who end up being very close to many positive causes, get resources from these industries, and they go many times against all this. So I think that it's very important to understand all of these strategies. And more, we believe that the change and that we need to make sure that these communications truly start by making sure that the grassroots understand. We in Red Papas in Colombia, we're working strongly with schools, with CSOs. There was a question or a comment here also that I thought was very interesting. Somebody said, for example, working with similar causes or good causes in the framework of human rights. That could be interesting. And so how do we join efforts? How do we join other causes? And how do we start being more the voices that are referring to this? Holly said something that to me is key. This is not a fight of these organizations against an industry. No, it's a struggle in favor of human rights, in favor of public health. And another insight that I wanted to share with you that I just read in the chat said, for some of the people who were listening to us, was that this seems they look like parents trying to guide their teenage kids, and then somebody shows up, somebody who shows up as the peer of these teenagers, and that's exactly what happens with these industries. Sometimes it's not as easy to tell your teenage kids, this is not a good influence, this is not a good friend. So I think that this is it. And sometimes these examples help you so that when we launch these campaigns that we generate this awareness, and it is useful to have these examples. So he who shows him or herself as the friend of the teenage kid is not thinking about the well-being of your teenage kid. So this is a good idea. Thank you.
Yo creo que es muy importante.
Thank you. Well, I think that it is very important that to the largest extent possible that we enter into regional efforts. For us, in the case of the report that we wrote with information from 6 countries, we clearly saw how there were strategies that were very similar with a different reach, with a different depth, with a different intensity regarding the communications with the audience and with decision makers. For us here in Mexico, it was very important that whenever they did any type of intervention by mentioning that they were not as harmful and that they had new services or more publicity, every time they did something like that, we would go out. Well, not necessarily us or as an organization, but let's say that there was a big response on the part of researchers of the National Public Health Institute, even OPS, to try to counter the advocacy efforts that these big corporations were doing, especially, well, in the case of Mexico, in the processes of tax policies, with the reduction in public income, after the COVID crisis. Well, they also came out to say that they had been affected in Mexico. There was last year an economic contraction of 8.5%. So all this, of course, helps us. And I think that after the report, we feel that in the case of Mexico and in other countries of Latin America, we feel that we should do additional reports, prepare additional reports now targeted at groups, pressure groups, such as the pro-vaping groups, which are also industry allies. They just come out disguised. And I think that we've done that in the case of Mexico here. Thank you.
From Lilia and then from Deborah. Lilia?
Yes, hello everyone. I would like to highlight momentum and join in the movement with other civil society organizations, not just in the region, but specifically with small regional organizations that in small towns, because raising this awareness on a local level and engaging grassroots organizations is very important. In the particular case of Ukraine, when we were fighting for safeguarding tobacco tax increase on heated tobacco products that are currently almost not regulated in Ukraine and in many other countries, it was important for us to expose tobacco industry lobby, and particularly those decision makers that were lobbying for the tobacco industry interest. Basically, naming and shaming is very important, because then the voters will know that that particular decision maker lobbied for the tobacco industry, not for the interest of their kids, their families, and in general of the interest of the country. And another important point for us on how to make our voice heard and visible is, of course, to partner with media. Sometimes it can be challenging. Again, in the case of Ukraine, we see that many media are bought by the industry, but still it's important to always look for a way to partner with influential media to get our voices out there, and then to raise awareness also among the decision makers that if they decide to work for the industry, not for the people of Ukraine, then we will make it public. And knowing that will prevent any potential decision maker from lobbying the tobacco industry interest. Thank you.
Yeah, so this is definitely a challenge that we see all over the world. On the tobacco side, one of the decisions that we made sort of early on was to really keep our objectives are not to stop the tobacco industry necessarily from engaging in philanthropy. That's something that is a problem for us. It complicates our ability to be successful. But when we sort of looked at, what are all the opportunities here, and where are some of the challenges that we're going to need to, where are challenges and opportunities that we could address, we started to, we really focused our efforts on how do we expose how tobacco companies are using the pandemic to further threaten public health. And so where we really focused our energy was on how to sort of make that pivot from, tobacco, maybe Philip Morris is making these donations. The reality is while they're making these donations, they're also marketing their products. They're using information that could be misleading. They're spreading this information to their consumers and really looking at ways to amplify that message. Because at the end of the day, what CSR really is for a company, a tobacco company, for perhaps for big food, is a distraction. It's really meant to scrub their corporate image. It's meant to achieve other objectives for those companies. It's not necessarily, it's not really the focus for our policy work. It is a challenge that we have to navigate, but ultimately where we were really advising partners in the field and then in our own work was to really focus in on how do we sort of monitor how tobacco companies are continuing to sell, market, and market their products and undermine public health policies, and keeping the focus there.
Thank you, Deborah. And you all have mentioned something that is like trying to respond to these creating messages. It seems like building alliances across countries and across regions and within regions might be a solution, or might be something that is helpful for all the processes that the tobacco and the food civil society organizations are working on. One of the questions that we have in our chat is related to how feasible, and if you have had any experience on building these alliances with other social groups outside of the tobacco control arena and outside of the food policy arena, let's say feminist groups, let's say environmental groups, and if that's something that you really think it's a potential for our agendas to raise a point. Juan Carlos.
Sí, es una pregunta interesante y voy a hablar desde la
That is
experiencia.
an interesting question, and I'm going to speak from the standpoint of Colombia, especially related to ultra-processed food. In Colombia, I think we have progressed quite a bit in the generation of these alliances in principle with the farmers organizations, because at the same time, as we consider that there should be standards that protect us from the action of these companies and the products that they promote and the consumption that they promote, we also have to defend food alternative and food variety. And the alliance with farmers organizations is key. With feminist organizations is key, also as someone asked in the chat. But we also believe that we should move towards alliances, for example, with animal defenders and union organizations in the Colombian case, specifically because one of the big junk food production company has a very big territorial control when it comes to the production of sugarcane in the country. So we believe that these alliances are very important. And let me add something regarding the previous question, Lorena. I think that part of these messages and part of the way in which we connect with audiences that might be reluctant to become initially interested in these problems goes through the way in which we approach them at a subnational level, and how we approach communities at a subnational level, and how do we approach subnational grassroots organizations, so that through the group with these organizations, focus groups, for example, how to generate messages and analysis that can be understood easier by the grassroots, by people who can end up help us mobilize people in favor of our causes. I think that's a crucial element, not to think that maybe the messages should come from us or the messages should come from communication specialists. Many times the messages can come from the bottom in the way in which they interpret in a better way things as complex as the causes that we defend. Thank you.
Yeah, thank you. To the question of working with groups outside of maybe just public health advocates who are looking into tobacco control or working on the marketing of unhealthy products, one place where we've seen good success is working alongside privacy groups or data privacy groups. So groups that not only, right, we might care what that data is used for, but they also care, generally speaking, about the collection of data, especially that related to the collection of data, of children's data. And so working with those groups that are, motivated by a similar or similarly motivated, and thinking about how they tie together and the strategies that we can work on together that are maybe the first problem is data collection and then the later problem is how it's used, but we definitely have shared motivations. And so that's another group, at least in the US, where we've seen success working together and partnering with maybe a less traditional group of organizations for our kind of advocacy community. Thanks.
Thank you, Sara. Lilia?
Yeah, in Ukraine, it was very effective for us to work, especially long-term, developing those relationships indeed takes time. And we did see that working with youth groups, even if they are not organized, but, those young activists, even those who are 15, 16 years old, but who identify what the tobacco industry is doing, and they don't want just to watch what they're doing because they know that their peers are trying those harmful products, and raising their voices and just, giving them guidance on how they can expose the tobacco industry marketing tactics was very effective in Ukraine, as well as partnering with anti-corruption groups. In our case, knowing that exposing the industry interference and trying to counter it was very effective by partnering with those groups who have very good experience in identifying the issues of corruption, absence of transparency, and in general how decision makers try to avoid Article 5.3 and raising awareness on that issue. And another good examples are partnership with consumer protection organization and economists. In terms of working on tobacco taxation issues, and especially in the time of the COVID pandemic, it was very important for us to secure the tobacco tax win. And without professional and influential economists, it wouldn't be possible. Thank you.
Thank you, Sarah. And we have been talking about, sorry, Lilia, and we have been talking about all these possibilities of working with other civil society organizations. But we also have the other side of that question, and those are a couple of questions in our chat that relate to how governments can manage this situation with industries. We know that all of these strategies are legal strategies, legal practices, and they need to be regulated. So how you handle, how we manage that between having civil society organization empowered and engaged in the process, but on the other side of the equation, how we make governments to regulate and what type of regulations are we asking for here?
I would like to comment on that, if I may, Lorena. I think that on top of everything that was said, rightly so, by all the panelists in terms of strategies, indeed the government, it's one element of the whole story that needs to be taken into account and strategized as such. I think that when you look at the implementation of the Framework Convention on Tobacco Control, Article 5.3 across the world, you would surprisingly find that probably that is the less implemented article of the FCTC altogether. And I think that needs to trigger a signal for us, all of us working in the tobacco control policy advocacy arena, because it signals that the very precise foundation of the work that we need to build in tobacco control is most of the times very weak. And when we talk about corporate social responsibility, when we talk about government rejecting partnerships with the tobacco industry and so on and so forth, we actually talk about a legal obligation for most of the countries that we're working on as parties that have ratified the Framework Convention on Tobacco Control. So I think there is a need for first all of us to do a better job in sharing our good practices in this area, and second of all to facilitate a bit of more regional cooperation among governments on the importance of implementing Article 5.3. And I think we can do both, and the civil society can be a very good enabler of this strengthening of the capacity of the governments to effectively implement, and in such a way to in a way ease our work at the other end in terms of facing these type of situations that we have talked about during the pandemic. I know there is a discussion at the convention secretariat level on further strengthening exactly this area of facilitating best practices sharing and increasing and strengthening capacity on specific articles of the convention implementation, including Article 5.3. So I think it's just a need for all of us to stay closer together and share more, and in a way facilitate our mutual work this way.
Thank you, Ramona. Holly?
Thanks, Lorena. So just in terms of in the food policy space and what governments can do. So many of the examples that we talked about were about donations of junk food during this public health crisis. And I know that many of the partners that we work with in many of the countries have already been in conversations with governments about creating protocols for donations to identify kind of healthier and unhealthier products and having clear guidance on what should be regulated and how that could be done. And I think very closely related to that from a policy perspective is thinking about having front of package labels on products to help consumers and the general public identify what are healthier and what are unhealthier products, which would make it easier in terms of donations protocols. But that would also help in terms of things like having marketing regulations as to what kinds of products should not be allowed to be advertised to kids or should not be available in schools. And so I think that there are those kinds of policy solutions that would help address many of the problems that we've talked about today.
Thank you, Holly. Carolina?
I think that another very important issue is that all of these actions should be supported by scientific evidence free of conflict of interest. One of the issues which in our opinion in Colombia is instrumental is talking to the government on an ongoing basis so that all of the decisions that pertain to common interest, to public good, to everyone's health should be made on the basis of the best scientific evidence available, free of conflict of interest. Something else that has also helped us at times, because regretfully, for instance, we have seen how associations of pediatricians or institutions with a lot of credibility, important institutions in Colombia, for instance, had agreements with the industry of ultra-processed products. So I think that in that case, we have to be brave from civil society and expose publicly that in that case, they cannot make a reliable recommendation when, on the other hand, these scientific or medical associations are receiving resources from the industry. So I think that that's something else we have to do together with what Holly said. It has to include making sure that the policies be based on the best scientific evidence available. It's fundamental to rely on support from academics, from academia, both regionally and around the world. Many times we use studies which are not done in our country, but which apply to our actions. Thank you.
Sí, muchas gracias.
Yes, thank you very much. I think that we must be clear with respect to us on behalf of corporations that we have institutions and people who are not angels, who have political intentions, economic intentions, that they are not involved in charity, that they're going to try to exploit political processes and processes before parliament and regulations. They will try to go before the Supreme Court of Justice to see how they obstruct this or through their front groups, any attempt to regulate this. In the case of Mexico, what has worked very well is that there is a lot of communication, an ongoing communication between organizations engaged with tobacco control and organizations that work on healthy food. And even when it comes to cancer and diabetes. And this has helped us extensively. Many times, even the position of an actor is important in regulatory processes and may change. If they see that we are getting there through another organization that is closer to them, for instance, organizations of diabetes or cancer. So it is of the utmost importance to think about this. They're not angels, but Also, in countries like ours, there are revolving doors, and not sometimes you don't see them as officials, but as corporate directors, and enabling advocacy processes, but from a different side. In the case of monitoring as well, it has been important to see if some political parties receive funds for their campaigns, because they have been convinced any advocacy process that we try to carry out with political parties sometimes are not fruitful, because even before we approach them, when they take office, many times in their political parties they have prior instructions given to them. So this is why it's so important to constantly monitor this and to be part of a network and to be part of these organizations with no protagonism, no, not playing a leading role, not to fight between each other. We have been very careful with this, giving the position to each one, but rather to be on top of everything.
And all our tobacco control partners and panelists in the show have mentioned the FCTC and how useful the FCTC has been for tobacco efforts. One of our questions from one of the attendees is, how close are we to an FCTC, but for the food realm? Is that something that is on the way? Is that something that is someone working on that? Or how we can have some baby steps towards such a framework for the food policy realm?
So I don't think that we're very close. That is certainly something that many of us think about. And I think the kinds of policies that many of our partners are already working on are
Nuestros aliados están
but we're not quite there yet.
Thank you, Holly. Any other comments or to this specific question? Juan Carlos.
Sí, coincido.
I fully agree with Holly. We aspire to have this, but I think we're really far from being able to accomplish it. I think that in different international arenas where food issues are being discussed, and this is to talk about specifically about this case, we need to do as much as we can to advocate for this. An effort conducted recently, for instance, with the preparation of the guidelines of food and nutrition systems, and now the preparation of the guidelines is coming up at the heart of the committee of FAO. And this is where you can start adding things a little by little, lead to baby steps towards hopefully in the future being able to meet that dream. Lorena, we have to talk about the challenge of framework convention of this nature. Although when that very important win was accomplished in the case of tobacco, in the case of food, we are speaking about a sector that clusters more corporate power, even more, because the merge between the companies leads to the fact that when you are taking on the food problem and you are seeking control, hopefully global level control for the aggressions of the agri-food sector, we're talking not only about beverages and ultra-processed products, but also companies that produce chemicals and seeds. They are all merged and work together, and some are intertwined with others. So this is a very big struggle. It will take several decades, I believe, but we are moving towards the right direction. I think that this is important. It's important to acknowledge this.
Lorena, gracias.
Thank you, Lorena. Well, I believe that today's conversation in itself is important progress to me. At least it's the first time that we are speaking about tobacco practices while we speak about food practices. And someone also asked over the chat, why are you not talking as well about alcohol issues? What happened with alcohol during the pandemic, for instance? I believe that this gives us some clues with respect to the path that we may take in the future. Although these are very different products, as Juan Carlos said, and perhaps the policies needed have their own specificities, I do believe that the pandemic evidenced that there are some practices that are very similar, because behind them we find what Eric Antonio mentioned, economic interests. No one is thinking about the welfare of the population or the well-being of the population. Everything that helped us with public health and products that harm health allowed us to understand that there are some issues that are common, that are the same in all of this issue. And perhaps, I think, we can take on the commitment, all of us who are working on these issues, to start laying the bridges to understand the specificities of each of these industries, to find that many things are similar. There are a lot of commonalities that pave the way to expand this work and this struggle towards these policies with some similarities. And this is just to give you an example. For instance, in Colombia, the fact that we had a tobacco tax, although it was small, has led to very good results for us. For those of us who are struggling towards the tax on sugary drinks, we now say that this is part of the healthy taxes as tobacco. So as you can see, I do think that we have to delve deeper into this and see how we can work together towards the health of all our families and of all the members of our countries, especially those extremely vulnerable populations, which I believe that in countries like Colombia, after COVID, we will be in a serious situation, a lot of inequality, diseases, and partly because of the actions conducted by these industries.
Sí, miren, los economistas
Economists understand it very well. There's a foundation of arguments and rationale on why some products cause more harm many times than benefits that they may generate. And there's a term that they use, which is negative externalities. Negative externalities is a term that involves the fact that these are economic activities whose private benefits don't compensate for the social costs they generate. In public policy books, and I have a master's degree on this, they give you an idea on policies and interventions that may help reduce the impact on the population. The impact even to increase the poverty at these times when we're going through a pandemic and an economic crisis globally, but particularly affecting some countries more than others. Well, we also have to understand that rationale. And to me, I think it's extremely important that in those policies and interventions, that the successful cases, even not only on tobacco control, as is the case of taxes on ultra-processed products in Mexico, you have to show the impact to little by little lay the ground and to move towards a framework, a convention in favor of healthy food policies, as could be the case now. We should remember that at the base, something that helped a lot towards the framework convention being passed were the some trials against the large corporations, both criminal and civil proceedings. From the side of food, this is an option that we need to explore, because it's a straightforward way to size the harm caused by an economic activity if it is not well regulated. I think that this is something that we must consider in our strategies from wherever we are working to be able to not only unmask the industries, as I said before, but also to reveal their intentions, to reveal how for many years they have collected information. They have not been against political processes or regulatory processes, or this is something that is very important to raise awareness about the need of having an agreement on or a framework convention on healthy food.
Conversation. It is exciting to see how, yes, we are not yet there for the FCTC in the food realm, but how much has the human rights approach and the human rights framework being helpful for your efforts, not only even for the tobacco control side that you already have an FCTC. We understand that this human rights framework has been very useful in pushing forward and defend some of these policies. And you were also mentioning, Eric, how the FCTC was reached through some legal claims and legal actions presented against the tobacco industry. So how much of those were based on human rights approach and human rights framework? So just to explore if this might represent an opportunity for the food and the tobacco control, but also the environmental people, the people that work on alcohol, because we're talking about health, we're talking about food, we're talking about well-being, we're talking about environment. So is that a framework that we could be looking at to defend some of these policies and counter the industry's action?
I think there is room definitely for that approach. And I think that looking at the tobacco control area, I think you start seeing this type of approach being developed. We are not there yet either in the tobacco control arena on human rights approach, but I think there are definitely some steps undertaken already, and there is already a good amount of work and data that is very well argumenting this approach. And I think probably that's an opportunity for the food policy as well, given that tobacco is also in its beginnings in using a human rights approach in its advocacy work. So why not an idea of joining efforts in this regard in terms of a joint work around human rights and industries that impact health in general? And why not use the opportunity presented by the COVID health context to further drive that message? Because I think that what came across also during the pandemic context is the fact that people started, I mean, the general public started to see health as a human right a bit more prominently than before. And the discussions in the public space around this, maybe it's an opportunity that we should grab and further build on in terms of human rights and these industries that are affecting the fundamental, not the basic, the fundamental human right to health.
Thank you, Ramona. Any other insights or comments? Juan Carlos?
Yes, Lorena, I believe that the answer is absolutely positive. The framework of human rights is at the core of our global struggle, nationally and regionally, for many reasons. The first one, because human rights themselves result from everything that affects us as mankind. We have not been given this right by chance. We have had to fight for those rights in many different ways for generations to be able to accomplish these rights. We have inherited this and we should uphold this. We should advocate for things that people died before years ago. In fact, for human rights, this is an ethical, fundamental reason to do it. The second reason is that human rights, if we take, for instance, the right to health or the right to food, already structure or configure a regulatory skeleton that become standards that may guide us, that may guide our own struggles and their demands with respect to the obligations of the states. And also that approach allows us to interrelate these specific struggles with others. I think that the best indication of how important the human rights framework is for our struggles is the relationship between the corporate power with respect to human rights. It's offensive. It has to do with a capture, and they're trying to legitimize it. So that's a very good symptom, a very good indication of how important it is for our approach.
Thank you, Juan Carlos. And Deborah, you also shared something with us in the chat.
Yeah, I think that a sort of human rights angle on tobacco control has really, I think it's been a concept within the movement for many years. It's recently gained a lot more momentum through an initiative called the Cape Town Declaration on Human Rights. And I shared a link to that in the chat, but I think it's a really good way of thinking about how we tell that story about a public health policy within that framework.
Thank you, Deborah. And as we reach almost the end of our session, we were wondering if you can have we can have from each of you in a short expression, how much do we need to make this public, like build the awareness in the civil society, but also how much it is important for all the civil society organizations working on this topic, not only to come together as an alliance, but also to push forward these policies before some governments that make it even more difficult to advance and counter industry practices. So just open the floor for anyone who wants to go first on those closing remarks from each of you.
I think that every time we come together in this type of events to share our best practices and our challenges, we pretty much all the time find out that we are so similar. And that every challenge and every opportunity in the same time, it's pretty similar across the world. So I think it's in a way a positive thing, because every time I'm reaching the end of such a meeting between us, I realize how powerful we would be if we would stay closer together ongoing, and how much the power of this collective frustration sometimes can be in a way used in our advantage to advance these policies. I think it's just we know what it takes in practically most of the areas, what it takes to get there and to reach our objectives. And I think that it's only a matter of staying together, of sharing more and more and more. And this should be fundamental to the work that we will continue to do.
Thank you, Ramona. Anyone else that wants to give us some closing words?
I think one of the things that always comes across to me when we meet with different movements is how our opponents really learn from each other and model each other and sort of take the strategies that work for another industry and adopt it and appropriate it for themselves. And I think that there is tremendous benefit in all of us sort of figuring out how we can work better together as well, but also looking at how we can broaden our movement. I think that a lot of the challenges that we are trying to address really sits at the intersection of many other social movements and other movements addressing crises like poverty and hunger, women and girls, equity. So to the extent that we can find new opportunities to collaborate, I really think it's what is going to make or break our ability to be successful in the future.
Thank you, Deborah. Any other person that wants to go?
Yeah, first I just want to echo my colleagues, but I also want to say, I think one thing I've learned during the COVID-19 pandemic, or one thing that we're looking out for at the Center for Science in the Public Interest is some of the concerns we had that have been expedited. So, the transition to virtual learning, things like that, concerns we had been expedited. They've come quicker and they're going to stay, marketing to kids, things like that. So as we think about solutions together as a group, what better time than now to be putting our, collective minds together and thinking about solutions to new problems, which are have emerged more quickly. And we're going to need to join together to come up with solutions and to change solutions that might work in one country and figure out how they might work in another, for example. So couldn't agree more that there's a lot of room for collaboration, and now especially is important.
Thank you, Sarah. Eric?
Yes, I think that there is an opportunity to document what we are doing in the midst of this crisis. I think that we have to sit down and write. This is a time that we had not experienced in decades, in 100 years. So there are many things. Even the industry itself has shown these as innovative at these times regarding their strategies and the way they approach the people. Hopefully, we don't go back to a situation like that, but this is something that has to be documented, and we need to learn from that to be better prepared in situations which are similar to what we experience. Hopefully it doesn't take place, but we need to be ready to take it on. At least in the region of Latin America, it has been a very important lesson learned to be prepared, and we're getting closer and closer to doing it. Thank you very much.
I don't see any more hands raised or microphones open, so just want to take this time to thank you all, our panelists, for this great session, and all our attendees for the interesting questions that enriched this space of conversation with each of you. We'll look forward to having these alliances and this coming together to work towards our policies. And thank you also to the Consortium of Universities on Global Health for letting us have this interesting space. So please, all of you, take care during these times, and we hope we keep in touch so that we can build on more actions globally.